Welcome back to another episode of the Movement is Medicine show. And today we're going to talk about what happens when you are in a car accident and you're injured. Because unfortunately, it does happen. And to help shine a light on this unfortunate but common occurrence, I have Dr. Ranim in the studio today. Dr. Ranim, welcome.
Hello, Barry. How are you?
I'm doing so good. How are you doing?
So far, so good.
So when it comes to car accidents, it's one of those things where it tends to seem like there's usually a few very specific injuries that we're dealing with in the clinic that people will sometimes have. What are those common injuries that we see?
So oftentimes with a car accident, we oftentimes see whiplash injuries and concussions. And what that means for a whiplash, like with the forward and backward motion of the head suddenly, especially in a rear end collision, those muscles around the neck tend to be injured. And that's why people feel some neck pain sometimes, some upper back pain. And due to the same mechanism, our brain is also impacted due to the back and forth motion of the head.
So that could lead to kind of concussion type things.
Mm-hmm.
Great. Okay, so we have whiplash and concussion. And so those are the two things that we're going to kind of take a little bit more of a deep dive into. And let's break those down. Maybe let's start with the whiplash. And I think we all know what we're talking about there. But if you were to describe the experience of having whiplash, what are we talking about? Like what happens there?
Well, in short, it's painful. But mainly, as I said, it's due to the mechanism of the car accident. So especially when we're not expecting it and we're not bracing for the car accident and our body just moves with the velocity that the previous car was moving in before it hit our car, our muscles tend to move in a certain way that they're not expecting to move in, and therefore it causes some muscle strain and some ligament sprain. And that causes some neck stiffness, neck pain, and for some people, it may even cause some headache and dizziness, because a lot of the proprioceptors in our neck affect how we feel and how may generate some headaches as a result.
Okay, right. So that's that snapping of the neck motion. Mm-hmm. And so then we're looking at potential, damage and strain and, soft tissue, or even there could even be some stuff going on with some of the actual vertebrae, but that's where we're looking at that neck and all that kind of thing. And so you're saying some of the primary things a person should be looking out for, headaches would be one, intense maybe neck stiffness, soreness, that upper back, any other common, like signs that, whiplash is an issue and we definitely want to get you treated.
Definitely, yeah. Sometimes people may start to experience some pain and numbness in the hands. That's a common one we see. Sometimes it may affect their mood, like they become more irritable or have difficulty sleeping. So those are also some common things to see that most people may not relate directly to the car accident. But just because of how our muscles are connected to how our brain functions, it definitely gets impacted.
One of the things that I can remember from a previous episode of the show, it's been a while, but it was the importance of getting in right away after an accident. As the longer you wait, let's say it's a Tuesday, you were in a car accident, there's some whiplash, potential concussion. The goal would be, as soon as you're really able to get in, is to get in so we can assess the situation and then start your treatment plan. And that the longer you wait in these situations, sometimes the worse off you can be. Is that accurate?
That's true. I agree with that. Especially in the beginning, if we didn't work on reducing the inflammation in the area and helping tissues heal in the proper way that they're supposed to heal, then we may end up with some scar tissues, we may end up with some chronic conditions such as like a chronic headache or some other stuff. So I would definitely recommend being checked in as soon as you can, because there are some treatments that we could do right away, such as like laser treatment, which is the least invasive form, but at the same time helps reduce the inflammation in the area and promote healing.
Okay, that's good. And that leads me into really my next question and my next thought, which would be, all right, so you've been in an accident. You're like, definitely some whiplash occurred. You just might know that for sure because you experienced bad whiplash. And you come in the next day. And so let's talk about how our recovery plan plays out, how we approach treatment in this particular situation. You mentioned something like laser, but I'm sure there's quite a bit more that we would look to do from an assessment standpoint, a diagnosis standpoint, and then obviously creating that personalized treatment plan. But walk me through what happens next.
So as you said, we'll do like some assessment just to determine like the severity and what's condition to diagnose you with. Like it's not gonna be always a whiplash injury, but that's the most common one, right? So we always do an assessment just to know how to approach our treatment, and depending on the presentation of the patient. But for some people, if let's say they no longer have their neck mobility and they would like to gain it back, that would be one of our treatment goals, and therefore we would work on the muscles around the area to help them feel less stiff after the car accident. And then we'll work on strengthening the muscles that need strengthening so that we gain back our mobility and strength, therefore functionality.
Okay, so it's kind of a hybrid approach that we're going to take. So essentially very similar to how we would approach most things. We kind of have a phased approach where we want to make sure that we're addressing the immediate pain or that immediate dysfunction and kind of getting a person to a spot where they are out of discomfort to as much as we can. And then we start to look at, that soft tissue mobilization and then potential other mobility strengthening work over probably a series of treatments to get them back to a spot where they really have the range of motion and the functionality and they're not in a state of pain.
I agree. That's true.
Okay, good. Well, that's really good to know. So let's talk about concussions now. So that's the other thing, and they kind of, I know sometimes whiplash and concussions can go hand in hand, like you said at the very beginning of the show. The fact of kind of getting that rear-ended or side, that velocity shift and change where the brain matter, your brain smashing against the inside of your skull or whatnot. Whiplash and concussion can often go hand in hand, although they don't always, right? But they can. So let's talk a little bit about then, concussions in terms of, how to spot a concussion. So, what should a person be looking for? What are we looking for? Or what are some of the signs and symptoms that a person might have a concussion?
Good question. So given the mechanism of, let's stick with the back and forth motion of the head, that's when the brain inside our head moves in that back and forth motion. It's basically gets something similar to what we call a bruise if you were to be hit like on any other part of your body. But what that affects, it affects our vestibular system, which affects our balance, our eye movements, our coordination, and it also affects the pituitary stalk, which also affects our hormones. So for some people, like balance may become an issue, something to look for. Visual problems may also become an issue as a result. And for others, it may appear as being low on energy, feeling a little depressed, a little irritable as well. And on the long run, it may even affect some hormones like our growth hormones, or for people who get menstrual cycles, that may affect or change their menstrual cycle behavior.
So it can be, so I guess what you're saying on concussions is that it can look quite a bit different depending on the person, probably the exact specifics of their injury and how it all went down, but it could show up in a lot of different ways. So it's not just a standard like, your pupils are dilated or something, or you have a hard time tracking. Because I think sometimes when people think about concussions, there's some of these ideas is like, can you follow a finger? Do your pupils, are they really big? But you're saying that might not even be the case, and you could totally have a concussion. There might be all these other signs and symptoms, some of which are kind of subtle that you need to be aware of that are potential indicators that a concussion has happened.
Oh, definitely. No two concussions are the same, even for the same person. Like even if the same person had a concussion, like a separate time, 2 different times, those two are not going to be the same depending on what part of the brain has been affected with that.
And being that it's your brain, this is definitely something that you don't want to wait on or mess around with. I think this is, again, goes back to that get in right away to determine, what the severity of the concussion can be as well, and how much it might be affecting you, so that then a treatment plan can be put in place.
Definitely, especially in the first 24 to 48 hours, we look for a lot of red flags in those, which such as changes in vision, or for some people even seizures. So red flags like that, or headaches that are too much painful, out of the ordinary. So red flags like that would indicate that we need an immediate interaction with our healthcare plan. So in those cases, a patient may be referred to the ER just to get a better evaluation, because things may be a bit more severe than just a mild case.
Okay, yeah, that's good. This is definitely one of those things to err on the side of caution and take action and get in right away. The other thing I would say on that too, just besides that, from a healthcare standpoint and a safety standpoint, that also is really great from a documentation standpoint, from an insurance and liability standpoint. So, getting in to see us at the clinic, getting that official diagnosis, getting that whole process going is really essential just from a documentation, insurance, liability standpoint. So, really when it comes to being in a car accident, it's one of those things where you want to take pretty urgent action. Don't wait around on that. But back to concussions. So when it comes to a treatment plan, so if every concussion looks a little bit different, what's the treatment plans then generally look like? What are some of the things that we might be doing in clinic to help with the rehabilitation, with the repair, with the healing process from a concussion standpoint?
That's a good one. We, depending on which stage we're talking about, but we oftentimes start with laser therapy. It has shown to be very beneficial in reducing the severity of those concussion symptoms. But on the long run, so to speak, we move on to more vestibular training, which includes some eye movement patterns, just so that we train the brain to get back to those normal movement patterns that it has. And the main one is usually the gradual return to play. So what that looks like, the first 24 to 48 hours, if there's no red flags, as we spoke earlier, then the patient could start by reintroducing some of the daily activities. We don't recommend the absolute rest where you're absolutely doing nothing. We still recommend doing some of the daily activities as long as the symptoms don't come back. So that's the general concept of the gradual return to play. But there are stages for it. So most people don't think of let's say their school or work as being part of the return to play or return to activity, but that still is a huge part. Because as we know in today's world, we're always in front of a computer, always in front of a screen. So when it comes to the time after concussion, that time in front of that screen needs to be reduced for a bit until the symptoms start to feel better gradually. So school work is definitely part of our plan, in which we try to help patients slowly ease into. And activity, definitely, we start them off with some light aerobic stuff, and then as they progress without symptoms, then we could add in a bit more physically strenuous stuff, depending on which stage they're at in their recovery journey.
Okay, so part of it is the idea that, listen, we're gonna assess where you are. We're gonna kind of try to narrow in the specifics of the concussion happening for you and how it's symptomatically showing up. But a big part of what we're going to do is make sure you're on the right recovery timeline, and that you're not trying to do too much too soon. But at the same time, you're not just laying around doing nothing, which maybe in some cases that could also be bad too, right? So it's we want to find the right balance for you based on your unique situation, and that structured program that's introducing the right exercises at the right time to help your brain heal, help your brain sync back up with your brain-body connection, and all of those types of interrelated connections between how your brain functions, your body functions, and being on a good plan can make the difference between that happening at a nice, good, steady clip or it getting derailed or having difficulties or challenges.
That's true. And that being said, like the recovery from concussions will not look the same for everyone and may take different timelines depending on the severity of the injury. So it could be frustrating at times, and that's totally understandable. But at the same time, we need to be patient and work alongside our body and how it's feeling along this journey.
Yeah, and part of what we like to be in a concussion scenario is potentially part of your care team. Yeah, you might be working with other practitioners, other specialists. You might be seeing a naturopath.
Definitely.
We might be looking at, there might be certain peptide therapies or other type of nutrient therapies that can be helping with the healing, because in that scenario, there's a lot going on, or there could be a lot of going on. And oftentimes we need a multifaceted, multidisciplinary approach, from your healthcare standpoint to get the healing that you want to get.
Absolutely. Yeah.
But we want to be part of that team. So I think key takeaways is that if you're in an accident, whiplash, concussion are two very, very common occurrences. And that our number one recommendation is get in as soon as you're able to the clinic so we can diagnose, assess, and create your personalized plan. And in some cases, recommend that you get yourself to the ER if we feel like that's the next right move. And that also benefits you because it creates now a documentation, accountability, liability trail from all the other stuff. So just from a overall protecting yourself, the number one thing to do is get in and take action so that we can start to put together your treatment plan.
You summarized it very well. Very much.
Thanks for being here. Thanks for shedding the light on this. More information on our website. And again, if you have questions or you need help, please go ahead and just let us know on our website or chat, send an email or give us a call, and we will get you the answers that you need to have to your questions. Thanks for being here, and we'll catch you on the next episode of the Movement is Medicine show.